I'm Dr. Jonas Apostol.
So, how are you guys doing? I hope you're all doing fine. So, ngayon, wala nang face shield, no? Pero, sa clinic, meron pa din. Pag papasok kayo or pupunta kayo ng clinic, there's always face shield, no? It required pa rin. They required it. But for some establishments like malls, wala na. So, it's a relief, no, for us, for most of us. So, yun. And also, tinanggal na yung mga like mga travel restrictions, medyo maluwang na. But we really have to make sure that we follow a minimum standard protocol ng COVID given by the yung IATF natin. So also we went to Baguio. So lang, mabilis, smooth sailing, and then easy. Tapos madaming spots din that open na. So yeah, I encourage you guys to go visit Baguio. So I will be presenting this very intricate case. This girl went to my clinic. With the chief complaint of having this asymmetrical smile, and then number two, uneven color of the teeth. As you can see here, medyo maputi yung ibang ngipin, and the other, especially on the front tooth, medyo super discolored na due to like it's non-vital, okay, and it has an existing filling material which is nag-iba na yung color, and also sa ibang ngipin are white and ang iba naman super dilaw, and also she's not happy with how it looks like. I mean, as a whole, yung smile niya, and also there are a lot of cavities, no, and then as you can see here, a bit collapsed yung canine niya on the upper right area, and then hindi na nakikita yung upper left molar and premolar area due to severe cavity and a little bit of posterior crossbite. So, ang dami natin i-consider dito, and also the gums, it's kind of gummy and medyo it affects her the totality of not just the health but also the appearance of her smile. So in this case, we did a thorough assessment, of course. That is very important to make sure that we know the problem from the inside. Like, we have to make sure that it is healthy muna, lahat before we can be able to restore it using indirect ceramics. So in this procedure, or in this case, I referred the patient to our endodontist to make sure that we were able to address the health problem. That's why pinaroot canal. And then number two, we established the bite by getting all the diagnostics, run it with our T-scan machine to make sure the distribution of the bite. So this is a very complicated case because it requires combination of a lot of treatment, and I also performed gum contouring on this case to ensure that we balance the gingival symmetry. So before we start the procedure, the patient was a bit anxious about the possible result of the reduction of the teeth. Kasi nakikita niya na medyo super invasive yung ibang procedure, like mga sharp looking na procedure, ay na preparation. But it's not true to our treatment for her because it's still minimally invasive. But of course, dun sa may mga unsound structure like yung ngipin that has cavity, we have to make sure that we remove all the cavities now. That's why sometimes nagmumukha siyang malaki, but it's not really that big kasi we don't touch the back portion of the teeth of the tooth naman. So selection of the color naman, we made sure that the color should complement her face, no? And skin tone. Medyo maputi yung patient, so we gave the patient a little bit whiter shade to brighten the face, and also bagay naman sa gums niya na color kasi it's not as dark or something like that, so it complements lahat. So the shade I chose for the patient was BL4 and B1. A little bit of translucency pero hindi masyadong super apparent yung mga mamelons or something, because mas bagay lang to kasi the original teeth niya hindi naman masyadong ganon ka-translucent.
2 weeks later.
So the patient waited for 2 weeks, no, for the ceramics to be completed. In this case, I used Emax Porcelain to make sure that we mimic the natural structure of the teeth, and also in this case we improved not just the color but also the anatomy, the morphology of the teeth, and also the distribution. Yung mga collapsed areas na canine and premolars, we were able to add more volume, and also the molars doon sa upper left area na a little bit problematic. It's due to the large cavities. Then we were able to restore it also. So this is the try-in procedure wherein we try to analyze everything to fit the design if we need to do a little bit of modification pa, so that once we cement the ceramics or the veneers permanently, mas satisfied yung pasyente. But in this case, happy naman na siya, and also the thickness and everything's okay, and she approved it and we cemented permanently. So after the final cementation, syempre at first the patient had an awkward feeling about the veneers. It's because it's brand new. It's not just a small modification or small changes, but we were able to enhance everything and improve everything, from the health to function to aesthetics. But at the end of the day, the patient will always feel a little bit of awkwardness or uneasiness. It's because of the brand new sets of teeth. But ganun talaga, that's pretty normal for any restoration. But after a week, okay na siya. Like, she has adjusted with the new sets of veneers and she's happy with it. And also, nag-improve not just the teeth itself but also the smile in relation to the face. It's a little bit brighter now, more balanced, more healthy looking, and healthier version. It's because we were able to remove all the cavities, and hindi wala na siyang issues with the new sets of teeth.
1 week later.
So recall is very important. After the final cementation, we have to make sure that we remove all the excess cement, and we give the patient yung night guard to protect the smile and protect the teeth, no, from grinding. So the patient was advised to go to the clinic every 6 months for follow-up, and also to make sure that we maintain the oral health. And that is very important. It doesn't mean that you have veneers. Yung ibang ngipin naman, may mga possible problems. So we have to make sure that we check everything. So in every smile makeover case, we have to make sure that we wait for it to adapt, no? Just like brand new shoes, nag-a-adapt yan habang tumatagal. So that's it. I hope you enjoy your time listening to me, and thanks for tuning in. I'll see you guys again next time. God bless.